Okay, so welcome to a doctor's report. How can you heal better and faster? So we're going to share to you some clear information today for you to understand why chiropractic works, how it works, and why you're here. And not because I'm coming, because I'm following the doctor's direction, but how you can make a change in your life and understand exactly what's happening. So here's what we're going to do. We're going to do one important thing is understand that we're not here to treat your pain and aches. We like for you to become the best version of yourself. As we know, we have some older patient here, Medicare patient are of course under chiropractic care, and we have an older patient, and everybody, we like for them to think about that. We want everybody to age gracefully, to have mobility, less pain, and happier when you get older. So it starts today. We cannot change the past, but today we can make some changes, and that's what we're here for. Our background is sports chiropractic and family care. So when I was younger, I used to take care of the Olympic athletes, the elite athletes, and they want to be the best performer. They want to reach their best. So that's in that spirit that we are here at Surgery Chiropractic to give you the best we got in chiropractic care, excellence in chiropractic care with a loving, giving, and serving attitude. And it's not about pain and aches. We want you to really adopt some new habits to be the best version of yourself. And so number one, how does the body heal? So some people say, can you heal low back pain? Can you heal neck pain? Can you heal headaches? Can you heal cancer? Can you heal digestive problem? Can you heal people having some difficulty breathing? Some people having some eczema, some allergies. How does that work? Number one, we're going to do a simple test. Imagine you cut yourself. What's going to happen? How do you really heal? When there is a cut in your body, how does it work? So some people say, hey, I'm going to put some ointments, I'm going to put triple ointments, I'm going to do everything I can to keep it clean. All of this is important, but think about it. Imagine I go to my fridge, I take a piece of meat, and I cut it with a knife. Ain't going to heal because one major ingredient is not here. It's called life. So life does the healing, correct? So the body has the ability to heal itself. If you cut yourself, if you fracture a bone, it will come together and heal. Sometimes you need help from the doctor to make it heal faster, but it heals itself. So the body heals itself. The body is amazing. Life does the healing, and it comes down because your neck, if it's in line, there is no remote control between your brain and your heart, your brain and your lungs, your brain and your digestive tract, or your low back, or your legs. Everything comes through the nerve that has to go through your neck. So in our clinic here, we are focusing on making sure your neck is in proper alignment so you can have the best flow possible between your brain and every tissue cell. Now, we're going to cover something very important for healing. Healing, as you understand now, starts with a healthy nervous system, but also you need to do your part. If you want the body to heal better, you need to eat properly, drink a lot of water, and you're going to have better cells, and you're going to be healthier. So that's the key, and we're going to come now into why you're here. Many of you are here today because you have pain. You have tingling, numbness, radiating pain, headaches. All these kind of symptoms brought you in because it's related to your spine. As you know, the nervous system controls everything. So of course, if you have a subluxation, that means it's caused by your neck or your spine being out of line. When the spine is out of line, it can affect the nervous system. So in chiropractic, we call that a subluxation. Subluxation is a misalignment that affects your ability to function properly. So today, we have some great medical doctors that do understand that. And one of them is Dr. Deepak Chopra. He's known, he's a famous on the West Coast particularly, and in the New York area. And he said that disease is not the results of just bugs, going to you, especially today with the immune system. We know that if you have a strong immune system, you're going to react better to the environment as if you don't. So you have to build up your vitality, your power within, your innate ability to heal. And that's the philosophy that we have into chiropractic. We want you to be stronger, you want you to be better, we want the nervous system to work properly. So Dr. Chopra says, all disease results from a disruption of the flow of intelligence. Yes, your body is smart. When you cut yourself, it knows what to do. Imagine that your body is controlling trillions of cells, miles of blood vessels, and your heart is beating from the beginning of your life until the last day, and you don't have to think about it. So to be able to heal, you need to have the nervous system functioning properly. All right, so that's the key, okay? Remember that. Now, most people, that's not the way they get started, As you know in society today, because you're bombarded with publicity, advertisement about if you have pain, take a pill. So people are taking pills for everything. Anxiety, depression, not going to the bathroom, sneezing, everything has a pill. So in our society, we'll be bombarded by trillions of dollars from a pharmaceutical industry say it's okay to do it. And then you go shopping and you take it. And basically today we are facing a major issue. It's called overdose death of pain medication. People are addicted, according to the CDC. That's the number one problem today is addiction to pain medication. And the same thing also, the CDC has warned us about the overuse of antibiotics. But still, patients say, hey, my ears are a little bit painful, I have a little cough, and automatically the remedy is antibiotics, even if the CDC said that's not what we're supposed to do first. So here, we want you to understand that. Imagine you're in your car and the orange light comes in. It's like the same with your body. If your alarm is up and they say, hey, you have pain, pain is usually the alarm system. So if you see the check engine light on, do you take your a marker and you go over it and erase it, or you put the color on it so you don't see it anymore, or you go to the mechanics and try to find out what's wrong with your car? Well, in our society today, we don't do that. What we do is like the alarm comes up, you have the problem, you have the pain, and you take a pill. And then you take 2 pills, and you get used to it. It's your comfort zone. And then you say, well, after 3 pills, it was better. And then I have patients coming here, they say, well, I've been taking 9 pills for pain for the last 6 years, and it's hurting again. So health is not the absence of pills. Of course, if you're diabetic and you have chronic health issue, we don't take everybody off any medication, or we don't diagnose people and give medication to people. That's not a part of chiropractic. But we want you to be aware of what you're taking and about not trying to numb the pain, because it's not going to help you. So health, what is really health? Is the absence of pain? No, health has 4. It's like 4 major pillars of health. One of them is spiritual health. God made the body, and the body is made to function properly. So that's spiritual health. So you have to work with your Creator and find what's best for you, and be guided from within to make the right decision. It's your health and it's your body, and your body is the temple of the Holy Spirit. So that's your responsibility, not the responsibility of somebody else. Number 2, physical health needs exercise, proper nutrition, drinking water. You need to have an attitude of gratitude. If you focus on problem all the time and you're looking at the news and you're looking at things that bother your mind, it's going to affect your health sooner or later. Stress is one of the leading factors of health problem and visit to the ER. So you need to work with that. You need to have an attitude of gratitude and be engaged in contributing to your environment and the people around you. Also, you need to have a good social life. It means you have to be engaged with your friends and family. All right? And if you're a college student and you're listening to me, you know what social life means, and that's not what I'm talking about. So social life is disconnecting from things that you do every day to have a good time. And that's the way you're going to become. So remember, social, spiritual, physical, and mental fitness. If you get these 4 pillars, you're going to be better. So I like for you to take a little break, grade yourself from 0 to 5 star on these 4 pillars of health, and see where you really need to put your energy to stay in alignment and help you heal better. Okay, so With Atlas Orthogonal, we have a lot of patients who have complex health issues. And I want to share with you one of the story. One of the lady that came here, she was referred by a dentist from Alabama, and she had 2 failed cervical surgeries. She has chronic neck pain, tingling and numbness in her hands and her legs, okay? And we accept those cases, they are candidate for Atlas Orthogonal because, as you know, there is no manipulation. We work with the instrument, and that's the safest way we can realign the spine. So if you're a candidate, like this lady was, she drove from Alabama 3 times a week for a while, and she was under pain medication, narcotics actually, and we're able to help her and return to a more normal life. She was not able to sleep on her bed in the beginning. She was sleeping on the couch, tilted, as she had so much pain in her neck. And so it's a change of life to get adjusted with Atlas Orthogonal, and we are here to give the best we can for the people who are candidates. So that's an example here, and we have many of those testimonials from patients that how Atlas Orthogonal, the adjustment of the cervical spine, changed their life, and that's what we're here for. So we do the best we can, and you have to do the best you can to stay in alignment.
Okay, now, so let's talk about what causes subluxations. So number 1, the thing that causes the most subluxations is trauma, okay? One of the first ways that we can get subluxated is through the birthing process. So as a baby is being born, it is very traumatic, okay? So the doctor a lot of times has to pull and shift this baby's head to get them through the birthing canal, and this could lead to subluxations. So if a child is having issues like ear infections and digestive issues and just very irritable, it's very likely that they are subluxated. I'll give you an example. My own child, my youngest Aiden, when he was born, he was able to feed on one side and latch and feed on one side, but was not able to turn and latch on the other. So realizing that, I gently adjusted his atlas, and sure enough, as soon as I did that, he was able to turn his head normally. A lot of the times that is all it takes for a child to get aligned. Car accidents. We live in Atlanta here, and so we see it all the time. If you're driving, someone on the side of the road who has been rear-ended. So number 1 thing that we see a lot is injuries from accidents. Also, we see a lot of injuries through sporting accidents. So with children, the number one sport that causes a lot of injuries we see is cheerleading. Actually, you get a lot of falls in cheerleading, and you don't have any protection, so you can easily hit your head and get a concussion, and this can lead to a subluxation. Okay, even if a child is playing on a jungle gym and he makes a fall, this can lead to a subluxation. So those traumatic injuries will definitely cause subluxations. So the number 2 way that we see subluxations occur is through poor posture. So that is how you're sitting, how you're looking at your phone, or how you're holding your phone. So nowadays, a lot of people are working from home now, and they are in this position where they're looking down at their computer, their head is coming forward, and the shoulders come forward as well. So you definitely want to avoid that. Keep your head over your shoulders, keep your shoulders back, all right? And if you can, bring that computer screen up to eye level. Also, if you're looking at your phone, you don't want to be bringing your head down to look at it. Instead, bring your phone up toward your eye level, and that is a much better position to look at the phone in. Another thing is, how long have you been misaligned? Okay, something that has been in that position for a long time is going to take longer than a subluxation that just occurred yesterday, as you can imagine. So those are all ways that will cause you to have longer time of becoming aligned also. All right, so the results of subluxation are usually you feel more pain, all right? So the pain itself is not the issue. The issue is the misalignment. And the pain is a symptom that shows up from that misalignment. So did you know that pain is usually one of the later signs that you are misaligned? Other things may show up beforehand, and that could be issues that are arising from where those nerves are traveling that have been interfered with. So let's say you have a misalignment in your mid-back. A lot of times the nerves that are being impacted are traveling to the organs, the vital organs, such as your digestive system, your stomach, also your liver. So by being misaligned there, it can lead to issues there in those areas. So it's important to not allow the pain to last for a long time, or the injury or issue to linger for a long period of time, because it's not going to get better with time. It'll only get worse. All right. So let's talk a little bit about home care here. When it comes to your injury, it's better sometimes to use cold or hot. All right. And so when is the best time to use cold? If your pain is causing inflammation, more heat in the area, and more swelling, that is when it's time to use cold. Okay, so with your cold, you only want to use the ice for about 15 to 20 minutes, and also you want to put a barrier in between your skin and the ice. So that can be a t-shirt, that can be a towel, but something to in between your skin and the ice. So when is it a good time to use heat? That's going to be if you're very tight or stiff, okay? So heat actually brings more blood flow into an area and causes it to relax, right? So you want to use heat in those instances when you're very tight. So if you're getting a cramp or a muscle spasm, the heat is something that can really relax it. So you can do that with a hot pack. You can do that with a hot shower or a hot bath. Epsom salt bath is great as well. So to recover faster, we're going to help you here in the office by keeping you aligned, but also it's very important to do your homework or to do things at home that's going to help the process. So one way of doing that is remaining active. So exercising, getting out there and moving. Our body was made to move, and so you want to do that. If you don't, you probably know the saying, if you don't use it, you lose it. It's very true when it comes to our body. So go out there, stay active. This is great for keeping your body in the proper alignment. Okay? Another great thing is massage and working on that soft tissue. So massage is excellent. We offer massage here in the office, but in between getting those very great deep body massages, it is important to also do home care there. So you can use the wand that we offer here in the office, and that's a great way to relax the muscles as well. Because if the muscles get tight, they very well can pull your alignment out as well. All right, so who is chiropractic for? Actually, chiropractic is for anyone that is living. So I mentioned to you earlier that when you're born, going through the birthing process is very traumatic for a child. So it's important to check children as well as adults in making sure that they're staying aligned. And also as you get older, things start to not function as well, you start to get stiff. So it's important that you keep yourself in alignment so that you can be the best that you can be as you age as well. So from ages 0 to 99, everyone should be checked. Everyone should be aligned. So I ask you to make sure that you stay aligned, get your family checked. You also should get checked and come in. We would love to assist you in your healing process here at Chiropractic, and we thank you for watching our video. Thank you.